Next week is spring break. All right. So here we go. Are y'all opened up to your books to the right place? We're going to be looking at the digestive system. Okay. So as an overview, we'll be looking at how we eat our food by putting it in our mouth, chopping it up with our teeth, breaking it down physically and chemically, and then swallowing it through the esophagus into the stomach, and then the stomach starts to do some stuff, and then it goes into the small intestine where the absorption takes place. It goes into the large intestine where all of the wastes are dealt with, and then whatever we don't use is exited through the body. We have some other organs that are called accessory organs to the digestive system, including the liver and the pancreas and the gallbladder. Okay, so I'm going to take things a little bit out of order. I'll let you know in your book when I want you to turn the page. I think I'm following the textbook, but it just makes more sense this way to me. And furthermore, it makes it where our lab, we can do lab today, and then in 2 weeks when we get together, we'll finish this up. We'll be talking about those accessory organs then instead of today. Okay. All right, so let's begin with a little video.
The human digestive system is large and complex. In this animation, I want to give you an overview of how it works. The digestive system's job starts when food enters the mouth. It is cut up and crushed by the teeth and moistened with saliva from the salivary glands. While all of this is going on, the food is being moved around in the mouth by the tongue. The tongue also supplies us with our sensation of taste. After a while, the food moves into the pharynx, which is also called the throat. It then passes from the throat into the esophagus. It travels down the esophagus and ends up in the stomach. The food stays in the stomach for a while. The stomach churns it around and mixes it with juices that are produced by the stomach lining. Eventually, however, the food gets pushed into the small intestine. This is where most of the actual digestion takes place. The food is broken down here chemically, and the macronutrients and micronutrients in the food are then absorbed through the small intestine and into the bloodstream. In order for the small intestine to do its job properly, however, it needs some help. First of all, to help it digest fats, the liver produces a substance called bile. That bile is then concentrated in the gallbladder, and the gallbladder then squirts the bile into the small intestine. The pancreas also helps the small intestine do its job. It produces several digestive juices, which it also squirts into the small intestine. Once the food is fully digested, it moves out of the small intestine and into the large intestine. At this point, it's a waste product, so it needs to be eliminated. The large intestine pulls water out of this waste and concentrates the waste into feces. The feces then travel through the large intestine, into the rectum, and out the body through the anus. That's a pretty amazing system, isn't it? And actually, all I've given you is a brief overview. As you read on, you'll learn even more details, and you'll see just how incredible the human digestive system is.
Okay, so I'm already starting to skip a little bit here, so you're going to hop down to the bottom of your page here where your chart is, and here is what we're going to look at. Okay, so there's your chart. Notice on the right side, you don't have to write that stuff down. So your very first word up there is pancreas. P-A-N-C-R-E-A-S. Pancreas is responsible for making enzymes to help digest proteins, fats, and carbs in the small intestine. It also is an organ that produces insulin. That's part of the endocrine system. Next comes your tongue, T-O-N-G-U-E, for the food, the organ that mixes food in your mouth. Then comes salivary glands, producing saliva. The gallbladder stores bile. The next one is called the pyloric sphincter. Pyloric sphincter. Then the pharynx is really your throat. The rectum for excretion area. The liver. The stomach. The small intestine and the large intestine. Yes.
What was the fifth one?
1, 2, 3, 4. Pyloric sphincter. P-Y-L-O-R-I-C. and sphincter, S-P-H-I-N-C-T-E-R. The pyloric sphincter is just what does it say? It controls the muscle at the end of your esophagus. There's also a sphincter at the bottom of the stomach called the cardiac sphincter. Top of the stomach, cardiac sphincter. Yes, I should have gone in and made those words a little larger for you. It's just such a big chart. All right, so that's kind of your overview of some of the minimum of the things you're going to need to know for the digestive system on a quiz in a couple of weeks, 3 weeks. All right. Ends with small and large intestine. Okay, so let's go now up a little bit. Go back up on your page there to the mouth. So digestion is the breakdown of food into smaller particles. So listen to that. Digestion, the actual definition of the word digestion is breakdown of the food. So really the digestive system handles two things, breakdown and absorption. Okay, so the digestion only is talking about the breakdown. The absorption is the second part of the system. All right, so digestion is the breakdown of food, guys, into smaller particles. After the food is broken down, it must be absorbed. There we go. So it begins in the mouth. The tongue, the teeth, and the jaws work together to physically break down the food. And of course, our saliva is in there to help. The saliva has certain chemicals in it. It also has mucus in it. That helps to break down fatty things. And as we're chewing, of course, the action right there will actually produce more saliva for us. And we can break that down. If you've ever tried to chew your food when you have a very dry mouth, it's difficult trying to swallow that food. So if you're nervous, sometimes you don't want to eat at all because you have a dried up mouth and you just don't even feel like eating. All right, so here are our teeth. Anybody here have any interest of going to dental school, becoming a dentist?
No.
I need a dentist in the family, folks, and I consider y'all my family. So in other words, y'all would give me a family discount is what I'm saying here. What now?
My uncle's a dentist.
Your uncle's a dentist. That's nice. Is he nearby?
He's in Canyon Lake.
Oh, I thought you said Canada, Canyon Lake. So he's in Texas somewhere. So you could go see him pretty easily if you needed to. Yeah, okay. All right, so it's important to take care of your teeth. It turns out that our teeth are kind of sort of the gateway of because it's our mouth, stuff that's coming into our body. And if our teeth are unhealthy, it tends to affect the rest of our body's health. So we need to take care of them. They have numbers and names for all of the teeth. Right here you can see that they're colored on these pictures right here. So let's start at the upper right there. So the flat teeth in the front are called the incisors. All right, those are flat. Those are for tearing. Then come the canines, these pointy ones, are called the canines. That's for tearing. If you ever had beef jerky, you probably put it to the side of your mouth so you can tear it a little easier. And then we have our molars, okay? So we have our, so that one with just the 1 point, the canine is called the cuspid, so cuspid means 1 point. Then we have our bicuspid, means 2 points on it. That's the next set of, and those are the molars. They're flat on the bottom with 2 points. And then we have the tricuspids, which have like the 3 points back there. Okay, so those are our molars, right? And so we start to lose our teeth at about age 6, maybe, right? You get that first loose tooth and that kind of stuff. But you still have molars. You can have. So have y'all lost all your molars yet? Some of you may not have lost, because there's some that come out later. You know, one of my sons, he was 17 or 18, and he goes, "Mom, I have a loose tooth." I'm like, "No," because that means it's an adult tooth, right? A permanent tooth. You don't want a permanent tooth to be loose. You know, that's not supposed. So we go to the dentist, and they say, "Oh, this isn't a permanent tooth. This is a baby tooth." It was still a baby tooth in his head, and we didn't know about it. And the problem was there was no tooth underneath it to push it out of place. So he just is short a tooth. He just doesn't have all the teeth in his head. So how many teeth do we have? As adults, we have 32.
31 for him.
31 for him, yeah. So we have 28 regular teeth, the ones I was telling you about, and then we have 4 special teeth. Do you know these special teeth?
Wisdom teeth?
They're called wisdom teeth, okay? And the reason they're called wisdom teeth is because they come in much later when you're wise, when you're old and wise, right? And they're way in the back, all right? The thing is we have, I had a student one time whose dad was a dentist, And he explained to me that because of the changing diet and the changing way that we're using our mouth, is that because in the old days when they didn't take as good care of their teeth, it was normal to lose teeth, you know? And so the wisdom teeth would come in later to sort of replace some of those lost teeth. And therefore, that's what they were there for, okay? Now, since we tend to take care of our teeth now and don't lose so many teeth, then those wisdom teeth are just extra and they're really in the way. So I had braces when I was growing up. Braces, yeah?
My hair.
I had, yeah. Did you have to have any teeth pulled out?
Well, I don't think so.
Okay, anybody, you had to have teeth pulled out?
Yeah.
I had to have 4 permanent teeth pulled out, and then I had to go and have 4 wisdom teeth pulled out. So I've had 8 teeth taken out of my head, all right, to make room to make my teeth straight, you know? And but now what they do is when you're younger, like when you're really young, like 9 or 10, they start putting stuff in your mouth, making your mouth bigger and wider and stuff so you can accommodate all your teeth.
Retainers,
Yes, all that,
expanders.
those little medieval looking piston things that go in your mouth and stuff like that, yeah.
I've had all of them.
All right, so I think you're supposed to write down that you have 32 teeth, right? Did y'all write that down? 32 teeth. And they do have numbers, you know, E1, E2, that kind of thing. So I think the ones they took out from me were some of those secondary molars. And then, of course, my wisdom teeth. Wisdom teeth, of course, are embedded into your gums. And I was in college when I had those removed, and I had to be done surgically, where I had to be put under anesthesia and everything. David?
I had a tooth fall out, and then it grew back in, and then that tooth fell out again, and it still grew back in.
That's weird. So you had 2 tooth. I wonder if it was just like crooked and you thought it was the same tooth, but it was a second tooth.
Yes.
I don't know. But weird things can happen. Like my son just didn't have. My mom never had wisdom teeth. Never had them. I told her she wasn't wise. No wisdom teeth. Yeah.
One time one of my teeth was loose, but it didn't fall out yet, and the tooth came up
Yeah.
and it came over.
Yeah. So if the loose tooth isn't coming out, my grandchild has this problem. Her tooth is loose, but she doesn't want anybody to pull it or anything. And the new tooth's coming in, and the other tooth's starting to, and it's starting to look like a snaggle tooth. Is what it looks like. Yeah. So it needs to come out. Let's look at that tooth a little more closely here. Has anybody here had a cavity before?
Only one.
Okay, they're painful, right? They're painful. Yeah, and fortunately now we're pretty enlightened on how to take care of our teeth. So I hope y'all brush your teeth, right? You should brush your teeth twice a day at least. When I was growing up, they said 3 times a day, and I was like, well, what do I do when I'm in school? So they expected us to bring a toothbrush to school with us.
They
And I was,
say that you should like clean it after every meal.
After
Or
every meal.
After every meal or after every like bigger snack you eat.
yeah, even a snack and stuff. And so I understand, I guess, you know. So have you heard of these little things called xylitol mints? You know this? They're mints with xylitol. You know, those spry mints. You know, it's like brushing your teeth. Did you know that? That's as good as brushing your teeth, except it doesn't scrub the stuff off of there. But let's take a look at this tooth right here. So this outer part of your tooth is called the enamel. It's a bone-like material. It's very, very hard, and it's white, so our teeth are white. And then, of course, we're looking at molars here. What will happen is if we get a cavity, something usually gets stuck down in here, okay? So notice below the enamel I have something called dentin. All right, that's living tissue. So this bone, while it's alive, it doesn't have nerve endings, but the nerve endings are right up in here at the dentin, and then we have what's known as the pulp. Brendan, you have a question?
I remember, so I once pulled out a tooth right here. I think it was the last tooth I've ever pulled out. And it was really painful, and I don't think it was ready to be pulled out because I pulled it out and the root was still there.
Oh no! Yeah, it probably wasn't ready, because
Yeah.
typically what happens with the baby teeth, the root will dissolve away,
Yeah,
and
my
there's
mom-
nothing holding it in your head
My
anymore.
mom looked at it, she's like, I don't think this was ready.
But it was a baby tooth?
Yes, it was.
Okay, all right, yeah. Because if it's not,
That
you
was
know, that would not be good. Yes, Olivia.
All of my teeth, like whenever I pulled them out, no matter what, like at the bottom, they were super thin but super sharp, and they
Oh.
had like a little bit of a curve, so it gets stuck. So I'd have to like put my fingernail like under and pop it out. But
Ugh.
it was so painful. Every tooth I lost.
It was every tooth you lost was painful.
Every
Oh, that's a bummer.
Yeah.
David.
Are dentists named after the dentin?
I think that word comes from the same, so I'm guessing the word dent. The word dent means tooth. You know, like denticles means tooth-like. Yeah, so les dents, D-E-N-T-S, they don't, is French for the teeth. Yeah, so that
Well,
makes
you
sense.
were happy.
John Mark.
You know, once I had to have 4 teeth pulled at the dentist. Like, I think they were just like normal teeth, and they just yanked them all out. And it was just so painful.
They didn't give you deadening in there, like anesthesia?
No anesthesia.
Okay.
It just plain hurt.
All right, so let's look back at this tooth right here. So when a cavity takes place, what happens is that there's a hole in your tooth, essentially. I guess you know that part, right? So if you get like, let's say you're eating Snickers, no? Skittles. Skittles are acidic and sugary and sticky. All right, so they'll stick here in your teeth, right here like this. Okay, and so when they're sticking in there, the acid starts to break into your teeth, into your enamel, and then the bacteria that are in your mouth that are normal love the sugar. They love it. So they start eating the sugar. So the bacteria come over here, and then they see a little hole, and they say, ooh, a nice place, and they start digging down. All right, so this acid and the sugar and the bacteria are all working together, and when they dig that hole, when it's about that deep, you can see the hole. The dentist can see it. He'll stick a little tool in there, and it'll stick coming out, if you know what I'm talking about, kind of funny like that, but it may not necessarily be giving you any pain yet. But then you can get that drilled out and then a little filling put in there, and that gets taken care of. Now, if it keeps going deeper and deeper and hits the dentin, then you're in a lot of pain. So when that happens, they can still get in there, drill out the hole, put in a filling, and you should be okay. No problem. But if it gets deep enough and wide enough, like this, it gets to the point where there's nothing they can do to save your tooth. All right, so what they want to do at that point then is to kill your tooth and fill it with stuff, and that's called a root canal. You heard of a root canal? Okay, so with the root canal, they end up cutting away a bunch of your tooth here. They reach down into this area, and they go all the way down to those roots, and all of that comes out. They pull all of that out. And then they fill that whole area with cement. All right, so the cement gets filled in there, it gets hardened, and then once you're turned 17 or 18, so if this has happened to you as a young person on a permanent tooth, then they won't do this until you're 17 or 18. When your jaw stops growing, they'll put a cap over the top of it called a crown. Question, John?
My sister had a root canal.
Yeah, so when you hear root canal, it's a pretty heavy duty procedure. They have to do major anesthesia. I don't think they put you to sleep. I've never had one, but I had one of my kids. My daughter told me, she said, "Mom, don't get a root canal because root canals cause cancer." And I said, "Okay, come on. How can a root canal cause cancer? I need to understand the mechanism here." So we ended up taking my son. One of my sons had to have a root canal when he was pretty young. I felt guilty about it, but he had it done. Didn't get the cap put on because he was too young. So when the time came to do that, we started doing some research on it, and we realized, so we went to what's called a biologic dentist, and she explained to me what was going on. I said, "Listen, my daughter says root canals cause cancer. I'm a microbiologist, just explain it." She says, "Oh, let me show you something." And so what she showed me, she showed me a report from somebody whose tooth, which had been gone through a root canal, had been sent off. They had pulled it out and they had sent it off, and the bacteria that was in there was unbelievable, the amount of bacteria. And these bacteria are some of the nastiest bacteria around, and they produce toxins. And those toxins get put into your body, and those toxins can make you sick. Now, I don't know about cancer, but they can make you sick, okay? So we have regular bacteria growing in this area here, and when you cut off the blood supply to all that right there, they turn into anaerobic bacteria, which produce toxins. So it's true that if you can avoid getting a root canal, so for my son, what we did, instead of putting the cap on his root canal, we had the whole tooth was just pulled. We pulled the whole tooth out, and this dentist was all for it. So that is my goal now, is to avoid any kind of root canals, so I don't have to put toxins into my body that way. So there may be dentists out there who I'm not a dentist, but that's what the dentist told me. So. All right, so keep your teeth healthy. Try to avoid having any cavities. One of the ways to do that is if you're going to eat sugary, chewy, sticky candy.
Don't eat too much.
Well, and just eat it. Don't linger. Don't let it just kind of sit in your teeth. And then drink some water afterwards and maybe use a toothpick or something like that. Just get that out of there, okay? So that I'm not going to, I like sugar. I will say chocolate. Chocolate is good because it's got a waxy coating on it and it doesn't stick in your teeth. How about that? So it's another good thing about chocolate. All right, what about our salivary glands? You can see we have several. We have 3 pairs. So we have the one behind here, the pair behind here, the parotid. You've probably felt these before. Sometimes if you're blowing up a balloon, something feels kind of funny back in this area right here. That's usually a parotid salivary gland. It kind of pops a little bit. But it's going to be producing saliva from over here. Then we have the one under the tongue called the sublingual. Sublingual means under the tongue. And sometimes when babies are crying, little babies are crying and they're screaming and their tongue is up, they'll actually squirt saliva right out of those sublingual glands. You can see those. Some people can do it on purpose. Some people go, and just squirt you with their saliva. And then we have submandibular, which is underneath right here. Okay? And I had a friend one time who had what was called a salivary gland stone. She had a little stone, like some sort of little calcified mineral that got stuck in her salivary gland. It was painful, so it was kind of puffy and painful. So she goes to the doctor and says, "What am I supposed to do about it?" He goes, "Here's what you do about it. Eat something really sour." So when you eat something really sour, guess what your salivary glands do? Really start producing saliva. And so what's that going to do? It's going to help flush out those glands. So she ate some like Sour Patch Kids or something like that. Something bad for her teeth, but good for her salivary glands. All right. Swallowing. All right. Once we've chewed the food, once we've got that saliva in there, we're going to take that food. It's turned into something called a bolus. It's not very appetizing sounding, but it's called the bolus. And then we use our tongue and the muscles of our esophagus to swallow this down. There comes a time when once you start the swallowing process, you can't come back. Like, so if you say you're chewing something, it's in your mouth, you can spit it out, right? But if you start to swallow it, and that second I say, spit it out, it's poison. Too bad, it's gone. It's not coming back. You can't stop the swallowing process.
Vomit.
And so you can see one thing I want to show you right here. Here's the tongue, right here. So the mouth is chewing, the tongue is going to push down, and it wants to go into this right here. The esophagus is a flat tube until the bolus is in it. Then it fills up, okay? So, but it's flat. Now, in front of the esophagus is the trachea. You can feel it. It's your windpipe right here. And it's open all the time. Okay, it's very firm. It's got cartilaginous rings on it. And it's firm because it needs to stay open all the time. Because you need to breathe all the time, right? So, but when we're eating, we don't want our food or drink to go into our windpipe. You've had that happen, right? It goes down the wrong pipe, you start to cough a little bit, this kind of thing. If it completely obstructs it, that's called choking. We want to avoid that, okay, because that keeps you from getting any oxygen, and you can suffocate that way. All right, so we have this special little flap right here called the epiglottis. The epiglottis flaps down, and when we swallow, so it automatically flaps down and closes off the windpipe, and the bolus goes down the esophagus right here. Now, there's a thing in your book right here talking about choking and how we stop choking. I'm not going to talk about that until we're at the respiratory system, because in the respiratory system is when we're talking about cutting off your breathing. So we'll go back to the Heimlich maneuver and that kind of thing when we talk about that. Here I'm going to show you, this is an x-ray of a person swallowing. They're in the midst of swallowing, okay? And so they're swallowing something that glows on the x-ray. So this is when a doctor wants to check to see if something's going on with your esophagus, if there's a problem. Like if you said, I feel uncomfortable when I'm swallowing, this kind of thing. And so he can check it by giving you this radioactive, if you will, glowing stuff, drink and food, and you'll watch it go down. Okay, so let's watch this person do some swallowing. Okay, so there's the patient. All right, and then they're going to take a bite of whatever. There it is. It's dark. And when they swallow, here's the epiglottis right here. It's going to flap down. Watch that flap go down. You see it flap close, and it kind of raised up. The whole thing raised up, flap closes. And then the esophagus is here. It's going to be much more obvious when you drink liquid. Here comes the liquid. Ready? Flap closed, there, down it goes.
Okay, video off. Recording.
So there's that little flap right there.
Okay, video off.
Now from the front, watch what happens. See how it's swallowing down? And I'm guessing that little curve is
Now follow it
curvature
down,
is across.
please.
There, it's going all the way down the side. There's the heart beating.
And
There's
back
the lung.
up.
It's
back up.
You're seeing the traces of it.
Up, up, up. Video off. Recording.
Yeah. So I'm not sure exactly what was wrong with this patient or anything was wrong with this patient. Maybe it was just for educational purposes. Yeah. So, all right, now I need you to turn your page to part B. We're going to do some stuff from part B, and then we'll come back to part A when we get back together in 2 weeks. All right, so we're looking, I believe we're going to be looking at the stomach. All right, so we saw the swallowing. It seems like a natural progression to go from swallowing to the stomach, which I think your book went to the accessory organs. So we're going to go to this. So here is the tongue. Here's the epiglottis, flap down. Here's the esophagus, flap tube. It's going to come all the way down and go into the stomach. Now listen, there's a muscular action in the esophagus and the rest of the digestive system and even other parts of our body. It's called smooth muscle, and the smooth muscles will push the food down into your stomach. Even if you're standing on your head, your food will get down to your stomach by this action. It's a strong enough muscular action. That action is called peristalsis. Peristalsis. And it pushes things down. Astronauts in space with no gravity can swallow their food just fine. Pushes it down because of muscular action. All right, then it gets into the stomach. Gets to the stomach. The stomach has a stomach shape. I've dissected all sorts of critters, and their stomachs all look like stomach, just like this, okay? That stomach shape to it. And you can see right here, we can see that the esophagus is going to end here. This is called the pyloric sphincter. No, this is the cardiac sphincter, and this is the pyloric sphincter down here. All right, and notice the top part of the stomach right here, which is generally empty, is called the fundus, kind of at the top part. The body, and then the end of the stomach right over there. All right, so do you have things that you're supposed to write down as far as the process? I guess I can turn my page too. All right, so food hits the stomach. Here he goes. This is that top box right there, y'all. The food hits the stomach. The bolus is mixed with gastric juices. Here's what I want you to say. The food gets mixed with HCl. That stands for hydrochloric acid. We're going to be working with hydrochloric acid today. We have to be careful. Hydrochloric acid is very acidic. It's about a pH of 1, 1.5. If you were to take your acid out of your stomach and drop it onto your skin, it would burn you. But it doesn't burn your stomach. Pretty cool. So you've actually probably experienced the acid of your stomach being painful, burning stuff if you've ever thrown up, if you've ever vomited. You know how it's not comfortable, it hurts. Right? It's because it's very acidic. All right? All right, so the HCl kills pathogens, helps to dissolve the food. All right, it's very, very strong at that. The smooth muscle action, the peristalsis of the stomach starts to mix the bolus around. Now it's turned into something called chyme. C-H-Y-M-E, chyme. And then chyme is propelled through the stomach to the small intestine. So it turns out the stomach lining is folded for expansion. It's got these folds in it. We call those folds rugae. And that you can see on the inside of the stomach. Have you ever seen one of those balloons called a punch ball balloon that's all, and you blow it up and you punch it like this, you know what I'm talking about? Yeah, it's kind of wrinkly looking when you start. I always think of the stomach when I think of that. So when your stomach is empty, it's kind of wrinkly, and when you fill it up, it gets like a balloon. So at Thanksgiving dinner, when your stomach is like whoosh, you know. Yeah, it's all blown up there, all right?
Isn't your stomach about the size of your fist?
When it's empty. When it's empty. Yeah, but after Thanksgiving dinner, you can sometimes see it. Boop. All right. Y'all get this process here? Here are the words I want you to know. Hey, HCl, hydrochloric acid, killing pathogens. The bolus becomes chyme, C-H-Y-M-E. And then it is propelled through to the small intestine. It goes from the esophagus to the stomach to the small intestine. And the words I want on this that I want you to know, HCl, hydrochloric acid, chyme, and that's it, small intestine. You could maybe rugae. Rugae are those folds on the inside of the stomach. This is what they look like. This is a model. This is not a real stomach.
Awesome.
This is the inside of the stomach. These right here, these folds in there are called rugae. It allows for expansion. It gets nice and big. Okay, so have you ever heard of heartburn? You've probably never experienced heartburn because you're young. But what happens is the acid in our stomach starts to come back up through that cardiac sphincter right there. And when that stuff touches the inside of your esophagus, it burns it. And so the reason they call it heartburn is because it's around the place where your heart is. And there have been some people who've had such bad heartburn they think they're having a heart attack. But really it's just heartburn, in what we call indigestion. And so sometimes this pyloric sphincter, the cardiac sphincter will loosen up due to some processes. One of those processes would be age. Another process would be pregnancy. Women in pregnancy tend to suffer from heartburn because everything's sort of relaxing in their body. Their body's going to be relaxing in order to push a baby out. So some of those other sphincters tend to relax as well. So we call that reflux right there. And then we can try to make that better by taking something, an antacid, that will make that better. Question?
Can I use the restroom?
Certainly. All right, the absorptions of nutrients. How does the body absorb nutrients from food? It happens in the small intestine. That's really important for you to know. Absorption takes place in the small intestine, not the stomach. The stomach's job is really to mix the food and to hold on to it. It's kind of like a storage bag for a little bit, and it releases it a little bit at a time into the small intestine, and the small intestine's job is to absorb the nutrients from the food. That's what digestion's about. Breakdown, absorption, right? This is important. It's long. It's called small because it's small in diameter. It's skinny, but it's very long. It's about 20 feet long, and that's just the actual intestine themselves. And when I show you the way they're formed on the inside, if we could stretch them out the complete length of them, they would be really long. All right, the gallbladder and the pancreas secrete enzymes to continue the digestive process. They secrete those enzymes right into the small intestine. A lot of that has to actually do with de-acidifying the chyme, making the chyme not quite so acidic, putting in some basic elements to neutralize that. Inside the small intestine there are the structures inside that increase the surface area, and they're called villi, V-I-L-L-I, intestinal villi. I'll show you a picture in a minute. Those increase surface area to absorb and pass them to blood vessels. I think these are blanks, yes? Okay.
Can you
What's
slow down
underlined?
for a second?
Can I do what?
Can you slow down for a second?
Yeah, they're up here. I think these things I have underlined are what you're putting in the book, yes?
Yes.
So our first blank is small intestine. And the second blank is 20 feet. Then comes gallbladder and pancreas. Inside the small intestine, intestinal villi. You can just write villi if you want, V-I-L-L-I. Absorb nutrients and pass them into the bloodstream, where it's transported to the body and given to the cells. Then the small intestine looks like a velvety surface due to the outer absorbing villi. So you can just write villi there as well. I mean, they are absorbing villi, but that's... All right, so we're going to look at some of these structures and see what they look like. And basically what they're doing is allowing, we're going to see it over and over in the human body where something will be folded and folded and folded. That's to increase surface area. All right, because if I stretch it out, you see there's a lot of area there, but I can put it into a small space. All right, so there's the small intestine. It's broken into three parts. Here's the stomach. The pyloric sphincter is the first part. It's about 1 foot long. That's called the duodenum or the duodenum. If you pronounce it duodenum, it'll help you to spell it right. Duodenum, duodenum. Then comes the longest part of the small intestine. It's called the jejunum. And then the final part of it that's going to hook up to the large intestine, this is called the ileum. So there are three parts of the small intestine: the duodenum, the jejunum, and the ileum. All right? Now, inside, we're going to see the lining looks like velvet. All right? Because look at these villi. So these villi are projections up like this, increasing surface area. And furthermore, on the villi are microvilli. So smaller villi on the villi. So we're going to look at a microvilli right here. Villus is right here. And you can see it's coming up. And look at the blood vessel comes in here. And it is absorbing all the nutrients coming from this very thin epithelial tissue on the microvillus right there. And this yellow thing coming up right here is called a lacteal. It's part of the immune system. It helps to digest fats in there, and then that helps us keep our immunity as well. All right, so you see our villi, and even up on the villi, the microvilli, even smaller villi on top of there. Here's the villi, microvilli. That's a microscopic picture right there. All right, so you see there's lots of area there for absorption. I think they said that if we stretched it out, it'd be like the size of the floor in a room this size. Like if we had carpet in a room this size, is how much microvilli you have in your intestine. All fitting in there. Okay, the large intestine now. So if the small intestine's job is to do the majority of the absorption, what is the large intestine's job? Once the nutrients are absorbed, it's time to remove waste products. So what's the big job? Removing waste products. The large intestine is shorter, much shorter than the small intestine, but it's a lot fatter. That's why it's called large. Okay, so it's got a larger diameter. It has 3 parts. Okay, it actually has 3 parts: the cecum, the colon, and the rectum. And the 3 parts of the colon are the ascending colon, the transverse colon, and the descending colon. So really this should actually say the colon has 3 parts. The large intestine has 3 parts, but they're different from the 3 parts of the colon. Ascending, transverse, descending. So it goes up, ascending, it goes across, transverse, it comes down, descending, right there. If you've ever had to take care of a little baby who had tummy trouble, there's that massage that goes around like this. That's the massaging their large intestine to help move stuff through them. It's called the love massage or something like that. Attached to the large intestine is a little piece of gut called appendix. The appendix. Do y'all all have your appendices? Everybody has your appendix stuff? No. You would know it if you didn't have it. It would have had to be removed surgically. Okay. The appendix, so we're going to look at it. Does it do anything? The answer is yes. Yes, it does do something. All right, and we're going to look at the details of that here in just a second. Because it has dense lymphatic tissue. Bacteria are living in our colon. So we have bacteria in all of our gut system, okay? In our small intestine, our large intestine, not so much in our stomach because our stomach is too acidic for that. But our bacteria are there living in symbiosis with us. They're very important. They help us digest our food. But the ones specifically in the large intestine are actually manufacturing a vitamin called vitamin K. And vitamin K is necessary for us to clot our blood properly. All right, everybody got their blanks on this? Everybody got that? All right, so here you can see it. This first part here coming in where the small intestine enters through the back part right there is called the cecum. Then our ascending colon, transverse colon, descending colon, and then the rectum right down here is that third part of it right there. Sigmoid, we don't talk about that as much. Now, at the very end of the very beginning actually, so I'm standing here, so my right side, okay? So this would be on your right side, is where the appendix is. It's hanging off. It's called the vermiform appendix, and here's why. It looks like a little worm. Vermiform, worm-like. So it's hanging off just like this, okay? And so because it's hanging off to the edge like that sometimes, it will get inflamed. It will get clogged. And when that happens, the bacteria in there will start to grow more, and it'll get really inflamed, and we call that appendicitis. Now, appendicitis would be very painful on the right side of your tummy, right here, okay? And so I've had, let's see, I know 2 kids who they were younger than 12 who had to have appendix removed. I had 2 students who literally were sitting in my class, and they were like, oh, man, my stomach hurts, and come to find out the next day or 2 days later, they had to have their appendix removed. And these guys they were 2 guys, and they were probably 15, 16. And so I asked them, I said, okay, here's what they always say. If you push down and there's pain, but when you let go, there's more pain. They said, absolutely, that was true. They'd go like this, and it hurt even more, that was one of the signs. One of the other signs for appendicitis, that pain, of course, where you can't even stand up straight. You're like walking like this, it hurts so bad. Fever typically comes along with that, and so if that ever happens to you, just do that little test and say, I might have appendicitis. So when that happens, what we try to do is try to get them cured, like by taking antibiotics or something like this to help get things working okay. But if we can't do that, we'll have to remove the appendix. All right, so here's normal, but if it gets inflamed, it looks like that. And if you don't do anything about it, the whole thing can blow up. And if it blows up inside your abdomen, then that bacteria gets released into your abdomen. We get something called peritonitis, and peritonitis can kill you. Some famous people actually have died from this. There was a famous silent movie star called Valentino. He died of appendicitis because he didn't go into the doctor when he felt that pain. Yeah. So, but most people catch it, and we take them to the doctor, and we do a surgical procedure where they literally just cut it off and tie that off right there, and then you just don't have your appendix. So can you live without your appendix? Absolutely. But does it have a purpose? Yes. It turns out it has lymphatic tissue, and that lymphatic tissue helps to keep us healthy. All right, so it's really the best to keep your appendix if at all possible. All right, lab time. We're going to be talking about stomach acid today. We're going to neutralize stomach acid.
Oh, I'm so tired.
Okay, so I actually do have hydrochloric acid for y'all today, so I need you to be careful. Remember we signed our safety agreement? I need you to wear goggles.
Yours?